So she came to us in September last year, okay, with pain in the left hip joint, which was worse from any exertion, worse from motion, movement. She was better from lying, and she was worse first motion as well. So sitting to standing, the first motion was bad for her as well. So that was a major complaint. That pain has been there for the last 3 years. So around 2015 it started. She also has a pain in the right elbow joint, which is worse lying on right side in the hand, right elbow joint. She has a back pain as well, which started after spinal anesthesia for cesarean section. She also has a pain in the back, which started after spinal anesthesia for cesarean section. She has some mucus in her bowels, which can have bad smell. She has a lot of dental cavities with swelling in her gums. A lot of dental cavities with swelling in her gums. She is generally constipated with very bad smell from the stools. Constipated with very bad smell from her stools. She has stress incontinence. Stress incontinence is whenever you cough or sneeze, involuntary urination. And urine is pretty bad smelling as well. Urine is bad smelling as well. She sweats quite a lot, especially on her forehead. Sweating quite a lot on her forehead. Again, which is a bad smell. With bad smell as well. She can be irritable, shouting as an expression of anger. She's absent-minded, with fear of accidents and death. She's a hot person, with desire for salty. And as I shared with you yesterday, we are starting with pathology from day one itself. She had done an MRI which shows chronic avascular necrosis of the left femur. The femur is the hip joint bone, and it shows an avascular necrosis. Avascular necrosis means there is no blood supply to the head, and therefore necrosis, that means there is destruction, degeneration of the hip joint. I'll pass on the MRI findings. Everyone can have a look and pass it around, please. So you understand she has pain in the left hip joint, right? So that pathology is obviously related to the external pains. So if you think again, yesterday we shared with you myasms, necrosis, myasm please. So you recall necrosis means destruction, degeneration, syphilis. So see, I'm sharing with you my thought process. What's the pathology? It's a syphilitic pathology, right?
Can you tell her age, please?
Sorry, 29. So, a syphilitic pathology. I'm just sharing with you my thought process for case 1. So, when you looked at the MRI, it's a syphilitic pathology, right? When you look at the symptoms, which sided pain? Left hip joint pain, right? aggravation motion, better by rest, right? So I was thinking of a medicine which has this modality because I didn't get anything else in terms of modality or any particular sensation she couldn't tell me. We asked about it obviously, but she couldn't tell us any sensations. So what we got is aggravation movement, better from rest, right? Now when you look at the right elbow joint pain, she mentioned it is worse lying on right side. So it is worse lying on the affected side. You're with me? She has the pain in the right elbow. Whenever she lies on the right side, the pain increases. So whenever I lie on my affected side, the pain is worse. You're with me? So when I got the aggravation motion better by rest, right? To be very honest, I thought of Brian. Because it's a simple modality, she's mentioning exertion, what makes her worse, lying makes her better. But unfortunately, Brian doesn't have that syphilitic depth to cover this kind of pathology. Now look at the other symptoms. You see again how we correlated miasm. Pathology is syphilitic. Look at the symptoms. Urine, I think, is offensive. I mentioned that bad smell from the urine. Stool has bad smell. There's something else which has bad smell. Perspiration has bad smell. Everything is syphilitic. She has a lot of dental cavities. Destruction, syphilitic. So A, not only the pathology is corroborating with the syphilitic miasm, you're with me, but B, the symptoms are also corroborating with syphilitic miasm. You're with me up to here? Now if you think of a syphilitic medicine which has this modality, because you see in the case you do not have any other peculiarities to prescribe, right? So now I want you to have a look please in your body kit for Phytolacca. Phytolacca. You'll see a lot of cases in the next 2 weeks of Phytolacca, my friends. If you haven't prescribed Phytolacca for osteoarthritis and joint pains, you're missing out on something big. Phytolacca. PH. Phytolacca. I want you to go straight to the modality section of Phytolacca. Straight to the modality section of Phytolacca. Anyone ordered any more body cake? You did? You can take it, you can pay later on. Pass it down, please. Can you pass it down? Did you get Phytolacca? Phytolacca, my friends, is a deep syphilitic medicine. And if you look at the modality section, I want you to have a browse to the modality section and I'll share with you. If you see, word sensitive to electric changes, that means it's from aggravation. Sensitive to electric changes here denotes thunderstorm aggravation. So whenever there is a thunderstorm, the pain aggravates. This is the feature of rust drops. Look at effects of wetting. Did you get that? Effects of getting wet. Feature of rust drops again. You know rust drops is worse from getting wet. When it rains, feature of rust drops again. You're with me? Exposure to damp cold weather. You got that? Feature of rust drops again. Night, again rust drops. Motion, feature of branding. Are you there in the modality section, everyone? Or Phytolacca? Phytolacca. The modalities of Phytolacca are a mixture of brania and rust drops. So if you see the getting wet is a feature of rust drops. The rain aggravation is a feature of rust drops. The night aggravation is a feature of rust drops. Motion, feature of brania. You with me? Better warmth, dry weather. Right where the feature of rust occurs again. Better by rest, feature of briny. So whenever my friends in an osteoarthritis case, if you have a mixture of briny modalities and rust modalities, Vitolacca is a top choice medicine to prescribe. You're with me? So she's saying that whenever I'm moving, my pain is worse. Whenever I'm at rest, my pain is better. Briny is generally better by lying on painful side. But she's mentioned she's worse by lying on painful side. You're with me? If it was bryonia, then she has pain in the right elbow. That would have been better when I lie on the right side. You're with me up to here? But she mentioned she's worse lying on the right side. Now I want you to see the introduction of Vitolacca, please. Have a look at the introduction. Fourth line in the introduction. Syphilitic bone pains, chronic rheumatism. You got that? Syphilitic bone pains, chronic rheumatism. Fourth line introduction. You with me? So, Vitolacca is a predominantly syphilitic medicine. So, think of those cases when you go back home of degenerative osteoarthritis. Patients are contemplating for a knee replacement because there is so much degenerative changes. You ask her, what is your modality? Can you tell me the modality? And sometimes better from movement, sometimes worse from movement. Rest, sometimes it makes me better, sometimes it makes me worse. So you're getting, sometimes your feeling is like bryonia, then again you're going towards rust ox. So whenever you're stuck in between features of bryonia and feature of rust ox, my friends, Vitolacca is the one. This line is absolutely mentioned in Allen's. If you have a quick look in Allen's for Vitolacca again, I want you to be absolutely clear with this medicine. There's a, yeah, Jude.
What about rhododendron? How does rhododendron fit into that group?
Rhododendron, I would say it's more thunderstorm aggravation medicine, and B, it's not predominantly syphilitic. Vitolacca is predominantly syphilitic. So in terms of the miasmatics, she has the pathology of a necrosis of the hip joint. So in that way, the pathology is covered more by Vitolacca. Did you see in Allen's? There's a line in Allen's, occupies a place midway between bryonia and rust ox. Allen's Vitolacca, please. Third or fourth line. It occupies a place midway between bryonia and rust ox. Cures when these two fail. And this is specially and only applicable for joints. So go back to your osteoarthritis cases which have not been successful. Work out the modalities. You see, there are some modalities of bryonia, some of rust ox. Try Vitolacca. You know this one. Yeah.
What sort of potencies are we talking?
Sorry?
What sort of potencies are we talking?
I'll come to this case. Just give me a moment. Yeah, what's the question?
The question is, you mentioned that the joints are related to the psychotic miasm, but in this case, it is a
because she has a necrosis, which is another deeper pathology which has been mentioned. If it is just joint pains, there is nothing in the pathology, then we are said psychotic. But with the joint pains, she's having a necrotic symptom, which is syphilitic. More structural. Alright?
So it's just destructive, and we don't consider the psychotic side of it. We go to syphilitic, the
You have
surface
to
miasm.
think of the superficial layer. Joint pains, if you consider as a whole, it's psychotic. But when you get an even better pathology to go along with, you have to take care of that pathology, which is deeper. So it's necrosis, which is a deeper pathology. In that way, that's more syphilitic. Alright?
Sorry, can homeopathy change structural destruction?
I'll say yes if you prescribe a syphilitic medicine. We generally, what I have advised her is we'll do a repeat MRI after 1 year. At least there will be some changes in terms of the necrosis. So if you prescribe a deep syphilitic medicine, that can take care of the surface. But firstly, you have to take care of the pains. That's why we generally, whenever we see these kind of cases, we advise you go for a repeat MRI after 1 year. We'll see what changes will be there. But obviously, before that, she'll have relief from the pains, which is a good sign.
great for necrosis of
You can gradually get better as well. At least you can decrease the gradations as well. Potency for this, anyone? We started this case with 30C. Why 30C? It's quite a deep structural change, and we started this case with 30C of Phytolacca. You understood the points of Phytolacca, everyone? So Phytolacca 30C was started with. And these cases, I want you to take a note in your clinical tips, please. These kind of cases where there is some degenerative changes, if you get an aggravation even with 30C, drop to 12C. 12C works really, really well in osteoarthritis. If you get an aggravation even with 30C. 12C is very, very useful, especially in osteoarthritis cases. Yeah, the 2 globules, put it in the water, ask them to sit for 3 to 5.
Okay. When you say aggravated with Phytolacca 30C, what symptoms do you?
The pain will be worse.
The pain.
The joint pain will be worse.
Okay.
So if the pain increases, then we will drop to 12C.
It's okay then, we go to 12C. It's a smaller potency. It's okay.
Yeah, because sometimes she's more susceptible to 30. So because it's a physical pathology, you can drop lower down to 12C. Because there is no physical symptoms. We don't have anything emotional in this case. So you can drop to 12C.
Could you please say dosage and repetition? How
I'll
are
come
you
to
giving
it,
it?
yeah. So we started with Phytolacca 30C on September 26th. Okay, 1 dose was given, Phytolacca 30C. She came to us back in October 26th. We generally do a follow-up after 1 month. So she came back, she mentioned the elbow pain was gone. The elbow pain was gone after the first dosage, so it was 100% better. The hip pain was around 20-25% better with the first dosage. Hip pain, the left hip pain, which was the main complaint. So we boosted in that. Boosted means giving placebo. So you hear this term boost. Boost means we gave placebo in October. Alright? Then she came back to us on 21st of November, again after a month. Right? And she mentioned the pain was standstill. That means it was 25% better, but there was no change. I'm sure, I think maybe Dan has shared this with you. Whenever we do a follow-up evaluation, we ask the patient, if you put your health status on a graph or if you put your pain on a graph, it is still standstill, it is gradually getting better, or it is gradually getting worse. So she mentioned that in the second follow-up, she was standstill. No improvement in a month. So 25% and standstill. Okay. So we repeated Phytolacca 30C again. Okay. In November, 21st of November, we gave 30C again, 1 dose for 3 days.
30C, I'm sorry, did you say?
30C again we repeated. So 2 doses of 30C. You with me?
2 doses or 1?
2 doses.
Once in September and once in November. Okay. September 30C, October placebo, November 30C again. And she's back after 2 months this time. We didn't see her in December. I'm seeing her after 8 weeks. Last visit was 21st of November. Today is 26th of January. She has mentioned that hip joint pain is gradually improving. Around 30 to 35% she has mentioned. The pain is a little bit better from since last visit, right, with the 30C. So we have boosted today as well, because she's gradually improving as well, right. And sometimes what happens when the patient is gradually improving with a particular medicine, try and go up to the higher potencies. I will not change with Phytolacca until I have gone up to at least 1M and 10M. At least I will go up to 1M. Right? I didn't start with 1M because you understand that could have been an aggravation because of the physical pathology. We started with 30C and we're gradually sensitizing her to, and we'll try at least up to 1M before changing the mix, or thinking of even changing the mix. Right? And also one of the things you have to understand that we have gained the confidence of the patient. She will not leave us because she's 30-35% better, which has not been there achieved with conventional medicine. Right? So in that way, that's positive for us as well. No. not only conventional. We had prescribed, I want you to have a look in Banerjea, please, for an acute, because sometimes she used to have an acute pain, and we prescribed an organopathic. I want you to have a look in Banerjea, please, for Gettysburg. Gettysburg water. This was an acute SOS, it's available in 1x and 3x potencies. Because many of us used to have a severe pain, sometimes we used to take the painkiller. We advise her not to take that and try taking Gettysburg instead if you have any pain. Did you get this medicine, please? Gettysburg water. It's in Banerjea. 1x or 3x.
Okay, can I ask a question?
Yes?
Okay. When you mention 2 doses, do you mean one pill in
Like
September
yesterday, I
and
showed you 2
November?
globules,
2
in a
globules.
bottle of water, 1 or 2 globules,
One
in
or
a bottle
two.
of water.
In September and November.
Yeah. So September 3 days, then October she was better, so we gave her placebo. And November again we repeated Prednisone.
Can you be specific? Is it 1 or 2 or 2 globules?
Mostly 1.
Mostly 1.
Mostly 1. But sometimes when the dispenser gives it, I advise them to give at least 2.
What is a dispenser?
Sorry?
What dispenser?
The people who are giving the medicine.
Dispensing stuff. Okay.
Today we boosted placebo. Because she's getting better. This is for an acute pain which she took only in October initially. But now she is not having any acute pains, so she is not on this anymore. She took it I think twice or thrice in between September to October. Sorry? No, this is 1x in trituration. So about 2 spoons in a cup of water, 8 hourly for the pain. I'll repeat this again. Do you get this medicine? Gettysburg water? In Banerjea? You see it's mentioned the line in the introduction, in the middle. Sensation of rigidity, worse movement. You got that? So she has the same modality like that, worse movement. So whenever you have the acute pain, don't take the conventional painkiller. Take the Gettysburg water. It works really well for the joint pains.
You use this as a painkiller only in joint pains? Or
Yes, only for
only joints.
Only joint. This is very specific for joint pains. Whenever she feels like taking the painkiller, you ask them don't take it, try taking Gettysburg instead. 2 spoons in a cup of water. Whenever you prescribe an organopathic, I'm making this absolutely clear, we generally give it in a cup of water. Like I shared with you the alcoholism medicines yesterday, 10 drops in a cup of water. Whenever you're prescribing any potency in C scale, we are giving 1 globule, put in a bottle of water and sip for 3 to 5 days. You're with me up to here? If she told me that after taking the 30C, my hip joint pain is worse, I can't move anymore. So then I'll wait for some time and then drop to 12C because 30C improves the accuracy. Clear? Up to here? Any questions?
I was just going to say that I'd never found the Gettysburg water, even though I've prescribed Avascular Pioneer, etc. How did you find that? Because it's not mentioned in the relationships with the remedy. So we should be adding it, surely.
Adding it to what? Adding it to?
The Gettysburg water,
Yeah.
I've never found it as an acute for a phytolacca or a rustox pain. So I just wondered, why do you think it's not there in the relationship section?
These are very small medicines sometimes which are not there in other relationships. This again learnt as an ancestral
We
thing.
should just think of adding it.
You can add this in your clinical tips for joints, please. Works really, really well. This is just for joints. Anicula is much bigger for the rest of the This is just for joints with the briny. Put this in your clinical tips, osteoarthritis cases, with briny modalities, Gettysburg. And you know what I do? When I started off, I used to do whichever book you follow, whichever, if you have your notes in the computer, wherever you have notes of briny, I'm sure you use briny quite a lot. Wherever you have notes for briny, just put a note, use Gettysburg when Brania fails symptoms. So that you'll be able to use these medicines more often. Also, obviously, you can put this in your clinical tips, but put a note in reference to medicines which you're using quite often. That is an easier way of practically dealing with it. Right?
Excuse me. If the patient takes too much this muscle picture, Gettysburg, would there be any problem with overdose?
No, because again you're following the 3 basic principles, similar, simplex, so there's no problem. Okay, so boosting today? Yes, okay. Can we have the report please if you have gone through it? Okay, everyone had a look at it, the report? We are boosting today, right? Thank you. She has traveled 3 hours to be here today to meet you all. So, she woke up at 4:30 in the morning.
Oh my God.
Wow.